everyone, this is Dhruv, a third year MBBS student from Dr. N.Y. Tasgaonkar Institute of Medical Science. And today we are gonna understand the basics of bronchial asthma. Yes, this is your lecture 2. Yeah, we survived the lecture 1 together, right? And I hope that you guys enjoyed the lecture 1, right? In lecture 2, it's going to be about the basics of bronchial asthma. Please don't think that it is just another pathology mechanism video. No, if you don't have your basics right, then you won't understand why are we discussing further things ahead in the lecture 3, 4 and 5. Right, I want you guys to attend this lecture with with your full attention. I have told you in lecture 1 to download my lecture and see them on DND, so that there is no notification, there is no phone call as well. So grab a cup of chai or a coffee. Yeah, I am a chai fan. I would love that if you grab a cup of chai. But without any further ado, let's start the lecture. Please pay attention. And also the notes that you see on the screen will be provided on the Telegram channel. Yes, so then you can revise these notes so that your revision goes much faster. So yeah, that is what we are going to do in lecture 2. We are going to understand the basics. Okay, very important lecture. Now here we are going to study about bronchial asthma. Cough ho gaya tha hamara. Yeah, so bronchial asthma which is there, what happens? Yes, there is difficulty in breathing. Why? Due to bronchoconstriction. Perfect. Just the basics. Bronchial asthma mein kya hota hai? There is difficulty in breathing. And why is that so? Because of bronchoconstriction. But my question is, why? What is happening in our body that is leading to bronchoconstriction? What is happening in our body that is leading to bronchoconstriction, and that is causing bronchial asthma, causing difficulty in breathing. So we are going to understand about the mechanism. See, in our body there is mast cell, MAST, mast cell. In the mast cell there is presence of histamine and there is presence of leukotriene. But today our main focus will be with leukotriene. So there is a mast cell with leukotriene present in it, and on exposure, right, on exposure to the antigen, there is priming of mast cell. Now it's going too fast. See, bronchial asthma is a hypersensitivity reaction, yes, no? Yes, it's a hypersensitivity reaction. Bronchial asthma is a hypersensitivity reaction, but which hypersensitivity reaction? Type 1, type 2, type 3, type 4. Type 1. And in pathology, we know that the type 1 hypersensitivity reaction is mediated by IgE antibody. Yes. So very important to understand before we go into the details of the mechanism that bronchial asthma is a type 1 hypersensitivity reaction mediated by the IgE antibody. Yes, please. Okay. So in our body there is mast cell comprising of the leukotriene. So on first exposure to antigen, which will lead to bronchial asthma, what happens? Nothing happens. There is just the antibody which is formed. Which antibody? IgE. What will it do? It will attach to the mast cell, called as priming. Very important. Sir, you are saying that bronchial asthma is a type 1 hypersensitivity reaction. Yes, sir. Sir, it is mediated by IgE antibody. Yes, sir. Sir, then there is an exposure to antigen for the first time and nothing happens, just the antibody is formed and it attaches to the mast cell. Yes, sir. Sir, that attachment of antibody to the mast cell is called as priming. Yes, sir. Yeah? Okay. Now, when the antigen enters the body for the second time, when there is a second exposure of the antigen, what happens? Yes, there is an antigen-antibody reaction. And because of this antigen-antibody reaction, the mast cell breaks. Yeah, the mast cell breaks. This is called as degranulation. Yeah. What is degranulation? Degranulation is the breaking of mast cell. So क्यों हुआ ये? क्योंकि जब second time antigen entered the body, the same antigen entered a body, yes, it reacted with the antibody. There was a reaction between antigen and antibody called as the antigen-antibody reaction, which led to the degranulation or the breaking of the mast cell. है ना, और वो ल्यूकोट्राइन रिलीज हो गया. Now when leukotriene is released, it will cause bronchoconstriction, leading to difficulty in breathing and causing bronchial asthma. Yes, please. Any doubts? Okay, I'll be obviously revise. Right now we are studying about the mechanism of the bronchial asthma. I told you, or I questioned you first, that bronchial asthma is a hypersensitivity reaction. Yes, it is. It is a type 1 hypersensitivity reaction mediated by IgE antibody. We are studying that why is there bronchoconstriction happening? The root cause. If we find the root cause, then we'll be able to give the drugs. Yes? So on the exposure to the antigen, there is formation of antibody which attaches to the mast cell called as, yes, priming. And on the second exposure to the antigen, what happens? Antigen-antibody reaction occurs, which will cause the degranulation of the mast cell, जिसके वजह से जो अंदर क्या प्रेजेंट है, ल्यूकोट्राइन, that will come out and cause, that will get released, that is what I'm saying, that will get released and cause bronchoconstriction, leading to difficulty in breathing, causing bronchial asthma. So far so good, very simple. Yes, चलो read कर लेते हैं. Bronchial asthma, which is there, it's a type 1 hypersensitivity reaction mediated by the IgE antibody. Yeah, हाँ जी, ठीक है. On exposure to the antigen for the first time, there was no antibody. Obviously, there was no antibody. Antibody was not formed. The moment the first time antigen came, the antibody got formed, IgE, and got attached to the mast cell, which is called as priming. So after exposure, priming of the mast cell occurs where the IgE is bound to it, right? Okay. On exposure to the antigen for the second time, please make sure that you understand this. That is, the antigen getting exposed for the second time, there occurs an antigen antibody reaction, by which the degranulation of the mast cell occurs, right, causing the release of the leukotriene. Release of it will lead to bronchoconstriction, leading to bronchial asthma. Yeah. So if I tell you about the mechanism, what happens? There is nothing, but there is an exposure to the antigen, right? For the first time, antibody gets formed. It attaches to the mast cell. That is called as priming. On second exposure of the same antigen, there is an antigen-antibody reaction by which there will be degranulation of the mast cell, releasing the leukotriene. It will go to the bronchus, act on the bronchus, cause the bronchoconstriction, leading to difficulty in breathing. This is a type 1 hypersensitivity reaction mediated by IgE antibody. Okay, we know the mechanism now. Now we'll study about the format. See, I know that in bronchial asthma, the main thing is bronchoconstriction. I don't want bronchoconstriction to take place. Then I'm very sorted. That is my treatment, ना. अगर किसी पेशेंट को bronchoconstriction हो रहा है, what will I give? Yes, bronchodilator. First drug will be bronchodilator. First class of drugs will be bronchodilators. Bronchoconstriction हो रहा है, I don't want the bronchoconstriction to take place. I will give bronchodilators and it's done and dusted. है ना? But let's say I don't have bronchodilators. What will I give? I will give drugs which can act on leukotriene and suppress the action. Chalo, I don't have bronchodilators. है ना? Then what will I give? Then I will give drugs which will act on at least leukotriene, so that the leukotriene don't go to the bronchus and does not cause bronchoconstriction. चलो ब्रोंकोडाइलेटर नहीं है, कोई बात नहीं, एटलीस्ट वो ड्रग तो देता था जो ल्यूकोट्राइन के एक्शन को सप्रेस कर दे. So drugs which will act on leukotriene, that will be my second class, in case I don't have bronchodilators with me. है ना? चलो ठीक है. Let's say I don't have drugs acting on leukotriene as well. What will I give? Chalo, I don't want my mast cell to degranulate. I will give mast cell stabilizers. That will be my third class. I don't have bronchodilators. I don't have drugs that will act on leukotriene and suppress the action of leukotriene. What will I do then? I will make sure that the mast cell does not degranulate. I will give mast cell stabilizers. और क्या, ताकि leukotriene release ना हो और leukotriene bronchoconstriction ना करे, है ना? Okay. Let's say I don't have mast cell stabilizers as well. What will I give? Anti-Ig antibody. Yeah, I will give the fourth class, that is the anti-Ig antibody, so that there is no antigen antibody reaction. पूरी राम कथा तो उधर से शुरू हुई थी कि जब एंटीजन एंटीबॉडी रिएक्शन हुआ, फिर वो डीग्रेनुलेशन हुआ, ल्यूकोट्राइन रिलीज हुआ और ब्रोंकोकंस्ट्रिक्शन हुआ. So let's say I will first give bronchodilators. I don't have that. I will give drugs which will act on leukotriene and suppress the action of leukotriene. So what are those drugs? हम आगे देखेंगे obviously. Let's say I don't have that also. I'll make sure at least my mast cell does not degranulate. I will go for mast cell stabilizers. Let's say I don't have mast cell stabilizers also. I will go for the anti-Ig antibody so that there is no antigen antibody reaction taking place. Now usually you guys study this directly. Now you will know the reason why we are giving these classes of drugs. We are giving bronchodilator because there is bronchoconstriction root cause. We are giving drugs acting on leukotriene so that the action of leukotriene can be suppressed and it does not go to bronchus, causing bronchoconstriction. We give mast cell stabilizers so there is no degranulation of mast cell. Yes. And we give anti-Ig antibody so that there is no antigen antibody reaction and the whole process is not repeated. Right? And I hope I've understood. I hope you have understood, rather, is what I meant. And I'm sure that your basics are right with this. Yeah. Last 1 minute to revise. Bronchial asthma is a type 1 hypersensitivity reaction mediated by IgE antibody. Yes. What happens on first exposure to antigen? Priming occurs of the IgE antibody to the mast cell. On second exposure, degranulation occurs. Degranulation हो गया, उसके बाद leukotriene gets released, acts on the bronchus, causing bronchoconstriction. Yeah. If I want to, solve the issue of bronchial asthma, I will give bronchodilators. Otherwise, if not, I can give drugs acting on leukotriene that will suppress the action of leukotriene. If not, I will give mast cell stabilizers so there is no degranulation of the mast cell. And if not, I will give, the anti-Ig antibody so that there is no antigen antibody reaction. With this, we have completed lecture 2. I hope you have enjoyed, you have understood. I'll see you in lecture 3. Bye-bye.